right. Hello, everybody. Can you hear me? Can you see me? That's always the question when you start a webinar, right? All right. Well, we'll just take a few seconds. We have like 2 minutes before 1 o'clock here. I don't know what time it is where everyone else is. I'm actually in Idaho, so we're in mountain time. But we'll give everyone else 2 minutes to trickle in. Looks like people can hear me and see me. That's awesome. All right. Well, while we wait, I would love to hear where everyone else is joining from. I am officially over winter. I am so sick of the cold weather. It's about 42 degrees Fahrenheit here, which I'm not thrilled about. But if someone has a view of some palm trees, I would love to hear about it. Boston. I bet you it's not very much warmer there either. Very much warmer. I suppose it's not any warmer there. Someone's from Florida. I bet you it's nice there. Texas, Atlanta, Georgia. Very cool. All right. So who is taking their NCLEX soon? Anybody? Is it coming up for anybody? Anybody graduating in May? I know May is kind of testing time for people who are finishing up with their last semester. A lot of people from Texas today. Very nice. All right. Well, for those of you who don't know me, my name is Courtney. I am one of the nurse educators here at NCLEX Bootcamp. And today we're going to be talking all about what Bootcamp has to offer. We're going to be going through, I'm going to take you over on our live site. So this is going to be a great webinar for those of you who have maybe seen us online, like on Instagram or TikTok, and wondering what we're all about and what we have to offer. So I'm going to show you all of that today. We're going to go over onto our live site. I'm going to show you our new study schedules, our test bank, our readiness assessments, our case studies, all of those great things. So that will be a nice tour if you were on the fence thinking about maybe if you wanted to use Bootcamp for NCLEX or not. This will be a great way to kind of find out a little bit more about it before you decide if you want to purchase or not. All right. And we are joined today, you probably see her in the chat, by Krista. Krista, you probably have seen on previous, our case study walkthroughs. She does all of our pediatric case studies. So she's over there in the chat. So if you have any questions throughout the webinar today, just drop them in for her and she will make sure that she gets them answered for you. All right. So shall we get started? Okay, so for many of you, you are thinking about taking the NCLEX or you're starting to prepare for it. And so the big thing that people always say when they get ready to take the NCLEX is they're like, oh my gosh, they're like, where do I even start? And we've got textbooks that are this thick and I've learned so much in nursing school and I don't even know where to start to kind of cram this all back in my head in a way that's really going to help me on the NCLEX. So we have got you covered. So if you previously been on our site, you probably noticed that we had like 1, 2 month and 3 month study schedules, which were great, but we've now made them even better. So I want to show this to you because I'm actually really excited about this. I don't know about you all, but I really love a good checklist and this really makes my brain happy. So this is our live NCLEX site. So this is a student view. And so we have everything that you need over here on the left-hand panel. So if we scroll down, you'll see under resources, there's a tab that says study guide. And so if we click on that, oops. Apparently I need to log in. There we go. If we click on our study guide, study schedule, there we go. You can see that we can now create a study schedule. So let me show you this. So if we click on this, this is fantastic because we can do our start date. So that's obviously going to be today. And then we can put in our exam date. So say maybe I'm graduating in May and I'm just got my authorization to test really early. I'm going to take it on the 28th. And so we'll hit confirm. And then we can select any days off. So Of course, we know that self-care is very important and we need to take days off from studying so we don't overwhelm our brains. So maybe I want to take like this weekend off, and then maybe I've got a long weekend here. And so we'll put that all in here, and that's great. So it's going to say I have 6 days off during this. And then we can create a study schedule. And look, we get all of it auto-populates onto a schedule for us. So this makes it so easy because all I have to do is go through and start off with reading Dr. Emily's study guide, join the NCLEX Bootcamp study group on Facebook, of course, get the NCLEX question of the day, and from there, I'm going to go into the basics, and it's going to tell me which case studies I should do, which standalone questions I should do. It's going to tell me when to take the readiness exam. Everything is on there, and then as we go through it, we can just start checking these things off, right? And then you're done for the day. If you miss anything on it, you can just hit rebalance, and then it will put it all back, kind of in a way that we can get it all done before we take our test in May. So this is a newer feature to our site, and like I said, I'm so excited about this because I really like a good checklist. So this makes it super easy. And then from here, we can just click on the case study, and it will take us directly to that assignment. So that's pretty cool. All right, so let me go back. And then, of course, we're going to take our Next Gen course. And this is on your study schedule as well. But if you scroll down, you can see under our resources, we have, there it is, our Next Gen course. And this is a really nice way to start off because if you're feeling kind of anxious about this next generation NCLEX, Dr. Emily has put together this really great course for you, which goes through the basics, talks about case studies, what they look like, how to approach them, and then goes through a full case study walkthrough, really to get your brain in the right space for answering these case study questions in a way that's really going to help you be successful. All right. So that is our study schedule. And then we have our question bank, which makes up kind of the biggest portion of all of our questions on bootcamp. And so we have a very comprehensive test bank. It's about 1,500 questions, which in your mind, maybe you're thinking like, well, that doesn't sound like a ton, right? We see other banks that have like 10,000 questions. And that is actually intentional because we don't think you need to answer 10,000 questions to be ready for the NCLEX. We think you need to answer about 1,500 really high quality, high yield questions. And that's what we've put written here for NCLEX Bootcamp. So let me show you what these look like. So if we go back here, we can go either get to those questions through the study guide that you generated, or we can go to our standalone questions here. And so we can pick adult health, child health, critical care. We can do it by subject, or we can go up here, which I like because you can really customize what you want to see here. So you can pick which questions you want to answer by subject. And then you can also pick questions based on the questions that you've tagged, and I'll show you what those look like in just a second. But I've actually bookmarked a few questions for us. So let's take a look at these, and maybe we can get in a few practice questions while we're here, because why not, right? All right. Okay, so let's find a shorter question here. Here's one. Okay, here's a mental health question. I know the answer to this one, so let's answer this really quick. We have a nurse at an outpatient clinic who is caring for a client who's experiencing a panic attack, and we're being asked which of the following actions should the nurse take? Okay, so let's think. What do we know about panic attacks? We know that this client is having really, really high anxiety, so they're probably not thinking clearly. So we need to keep them safe, and we want to bring down those symptoms of panic, right? Because having anxiety that high is very, very unpleasant. We want to get them to calm down. So we need to find an option that's going to help us do that. Does anyone have a guess? I'm open to guesses. I see someone's commenting. Okay, a lot of you are picking 2. Okay, so let's take a look. Okay, our first one is to encourage the client to remain seated. I mean, it's not the worst answer we could pick, but it's not correct, really. In the sense of sometimes clients who are feeling really anxious have a lot of anxious energy, and so they might want to be pacing around or getting in some kind of movement, and that's okay as long as we're in a safe space so we can pace with them, walk with them. That's fine. So we don't need to make them sit down. 2, dim the lights and turn off the television. What do you think? I like this option because this is going to help reduce environmental stimuli. And if we think if someone's panicking and they're out in the waiting room and like the TV's on and there's call lights going off and there's phones ringing, like there's a lot of stimulation, it's going to make the anxiety worse, right? So to bring that anxiety down, we need to reduce environmental stimuli. And to do that, we can dim the lights, turn off the TV, make that space calm and quiet. So I like this option. But let's look at what else we have. Give the client privacy by remaining outside the room. What do you think? No. If a client's panicking, we need to stay with them until their panic comes down, because remember, they're not thinking clearly and this could put them at risk for making impulsive and dangerous decisions, so we don't want to leave them alone. And then I see a couple people have chosen option 4, but I want you to read this really closely and then think again if you still want to stick with this answer. Instruct the client to breathe in and out in quick, shallow breaths. What do you think? Should they be quick and shallow, or should they be slow and deep? We want them to take slow, deep breaths. If we're going to have them breathe quickly and shallowly, they're probably going to hyperventilate, and that's not going to be good. So I think everyone else, let's see, is liking number 2. All right, so let's submit it, and then I want to show you what's going to pop up here. So this is kind of where the magic happens. So we have this green bar underneath here, which is going to tell us how we scored. It's also going to tell us our time spent, and that is really important when we think about being successful on the NCLEX, because if we were to get all of those questions on the NCLEX, remember the NCLEX is timed, and so we want to be spending about 2 minutes per question to make sure that we can get through all of the questions if we were to get that full test. And so we're aiming for about 2 minutes per question. All right, and then let's move over to the right side of our screen here and see what we have here. So all of our questions, our rationales are under 250 words because we want to make sure they're short, they're concise, they're to the point, they tell you what you need to know. And they have a lot of embedded info in them. So a lot of times they might have images embedded in them or tables. In this case, we have kind of the diagnostic criteria for a panic attack you can take a look at if you were feeling a little unsure about what a panic attack was. And then our top piece here is going to show us everything about why our correct answer is correct. So it's talking about decreased environmental stimuli, helping that client calm down. And then if we go down even further, the reason I said our questions were so high yield is because that we have a lot of learning built into the incorrect answer options as well. So it's really important that you read these. So here we're talking about why we don't need to have that client stay seated, why we might want to pace with that client, have them walk around, punching bag, what have you, to kind of expel some of that nervous energy. Why we don't want to leave the client alone, and why we want to encourage like those slow, deep breaths. So that has a lot of great information in it as well. So if we scroll down even further, we have our key takeaway. And this section is great because it's just a really quick blurb that says, this is what you need to take away from this question. This is what you need to know. Because ultimately, we can't predict exactly what question you're going to get on the NCLEX or exactly how they might phrase it, but we can pretty accurately predict themes based on the test plan and pretty in-depth text reviews. And so we can predict themes. And so if you get a question about a panic attack, what we're saying is that if you understand this key takeaway, you'll be able to answer that question successfully. So it's important to read the key takeaways down there as well. If we scroll down even further, we have our Ask Bootcamp AI. And so this is just an AI chat where you can ask questions if you want some clarification, get some answers back. And then even further down, if you still have a question, you can contact our team. And so if we click on this, it's going to pop up. It's going to tag the question that you're asking about, and then you can send us a message and somebody will get back to you within a couple hours with an answer. So that's also a really nice feature if you have questions or feedback on the question. And then remember when we pulled up our kind of create a test button and we could create tests based on our tags, this is where you're going to find these. So if we get this question right, it's going to tag it green as the saying like, hey, we know stuff about anxiety, we're good to go, we don't need to review it again. If we get the question wrong, it's going to tag it in red. So that means you can create a test out of just all of your red tags or things that you're still learning about. But maybe we answered this question and we kind of guessed and we got it right. We can say, well, I don't really feel that confident in it. I'm going to tag it yellow and say that I'm still reviewing it. And so we can create tests based on these questions that we've tagged. All right. So that is our test bank. And then we also have all of our case studies. So we know that the next generation NCLEX has case studies. And for some people, this has them feeling a little anxious because they're kind of new. but we have a lot of case studies that you can practice with. And so if we go back to our our left-hand tab over here, you'll see case studies right up here on the top. And we have case studies in adult health. We have case studies in child health, maternal and newborn health, mental health, critical care. You can see there's a lot to practice with. So I want to show you what these look like, because these look very similar to what you'll see on the actual NCLEX. And so I'm just going to pick one here that I haven't played with before. Okay, so these look very similar to what you'll see on the NCLEX. We have our client data tabs, health history, assessment, vital signs, and then the same kind of item types you'll see on the NCLEX. So this is a select N, or select 4 findings that require immediate follow-up. So without taking the time to read through all of this together, let's just see, I'm just going to kind of randomly pick 4 of them here, because I want to show you what it looks like once we submit these answers. So let me click submit, and it's going to say, well, I didn't get very many right. We kind of knew that. And then it's going to give us the same things we saw on the standalone questions. So we're going to see how we scored, our time spent, kind of how the average user in our bank is doing. And then the really nice thing about our case studies is they all come with video walkthroughs. And you might have seen people talk about these like on Reddit or Facebook. Students have really liked these. And so for each question, so every case study has 6 questions. For every question in the case study, you're going to get a video walkthrough. And this is done by one of our nurses. Here we have Dr. Emily, who is talking to us about why were the correct answers correct, why were the incorrect answers not correct. And this is super helpful for people who are more auditory learners, or they just like to, it's kind of like having your favorite clinical preceptor with you, kind of telling you what they're seeing and really how to think through this case like a nurse in a way that's going to help you be successful on the NCLEX. So all of these videos are typically less than 5 minutes. They're really short, to the point, and give you just what you need to know. And so those are really helpful, and students have really liked those. And then again, you're going to get our rationales. That's going to talk about why the correct answer is correct, why the incorrect answers are incorrect. Again, a lot of great information built into even the incorrect answer options. And then of course our key takeaway. So what do we need to know to kind of understand the content of this question? All right, and then one of the last things I want to show you is our readiness exams. So everyone loves a good readiness exam, right? Because it kind of helps to predict how ready you are to take the NCLEX. And so we have 4 of these, and the study schedule you generate will tell you when to take these. And so typically you'll take one at the beginning, another one sometime in the middle, and another one sometime at the end of your study plan. The goal is that you continue to see those scores improve. And so our readiness exams, they're not just a compilation of like 100 random questions. They were actually written specifically based on the NCSBN test plan, which means that the content that you're going to see on the readiness exams very closely mimics what you're going to see on the NCLEX in terms of the percentages of what questions fall in what category. So for example, on all of our readiness exams, 18% is going to be in management of care, 13% infection safety and infection control, 9% psychosocial integrity, and so on. So the themes are going to very closely match the NCLEX. So let's take a look at what those look like. So I'm going to end this and say yes. Okay, and let's see our readiness exams again on that left-hand side. We can click on it, and I'm going to reset this so we can look at it. Okay, so we have readiness exams 1, 2, 3, and 4. So of course we're going to start with number 1. And I'm going to click onto that. And then we're going to get a couple options that pop up here. So it's going to ask us if we want to add the delays between questions, disable the cross out and highlight to more accurately simulate the Pearson testing experience. So we can do that to have a more realistic testing experience. And then if we have any testing time accommodations, you can click on those here. And then I'm going to click start. Okay, so these questions, I'm just going to randomly click on a couple answers here. You're going to see we're not going to get the rationale popping up in between because this is meant to simulate the actual testing experience. And I'm just kind of randomly clicking answers here so that we could see what this looks like at the end. But of course, you probably want to spend a little bit more time reading through this if this was your exam. Okay. And since you probably don't want to watch me click through 100 questions, we'll stop there. And I'm actually going to end this exam so we can see what it looks like on the other side. But in theory, you would go through all 100 questions and then you would submit exams. This is just telling me that I have unanswered questions. I'm going to say I know and submit it. And then we're going to get a really nice page of feedback that is going to be super helpful for studying. So you can see that I did not score so well with my random clicking. I have a low chance of passing. I scored a 1%. But we can see how we stack up to the average. So the average students averaging 64%. We can see the time we spent per question. We're going to get a nice message from Dr. Emily telling us how can we improve, how do we remediate, what do we need to look at to kind of help boost the score for our next exam. And then we're going to get a breakdown by subject. So we're going to see pharmacology, management of care, fundamentals, child health. And then if we scroll down even further, we're going to get a breakdown by subject. So we can see maybe we're doing really, really well in pharmacology, but not so well in fundamentals. And so that's going to give us a good idea of where we need to give a little bit more attention to before we take the NCLEX. And then it's going to give us a specific question breakdown. So a lot of great information in here that's super helpful when you're studying. The other thing that I want to show you while we're here is our performance tab. So this shows you how you did on the readiness exam, but if you want to see how you're doing overall in the question bank, you can click on performance. And this is two really important benchmarks that are really helpful to keep an eye on. So what this tells us is your overall score in the bank. And so you're aiming for a 61% or higher, and how many questions you've answered in the bank. So the reason we do this is we want you to meet both targets, because say that you are like really great in pharmacology. You love pharmacology. It's your thing. You're really good at it. And that's great. And so say you come into the bank, you answer all the pharmacology questions, and you're scoring like a 98% because you're just awesome at pharmacology. But you're probably going to get other questions other than pharmacology on the NCLEX. And so we want to make sure that you have seen enough of the question bank and you're still scoring 61% or higher to say that you have a really, really good chance of passing the NCLEX. So you can see that 99% of NCLEX Bootcamp students who met both targets passed the NCLEX. So that's a pretty good benchmark to say that you're ready to take it. And then if we scroll down even further, we have subject performance. And so again, this is going to show us maybe like we did really awesome in pharmacology, but mental health, maybe we didn't do so good. Or in my case, maternal or newborn health probably wouldn't do so well. So again, it's going to show us areas where we need to pay a little bit more attention to before we feel like we're really confident and ready to take the NCLEX. All right. So the last thing I want to show you are our cheat sheets. So these are not brand new, but they've been new probably since about last fall. They started coming out. And our cheat sheets are, in my opinion, fantastic. And I love them because they are such a high yield study resource. Because think of maybe you're going into adult health and you're like, okay, I need to study about COPD. You could go to your textbooks and you could read a huge chapter on COPD and find yourself wondering like, okay, what do I really need to know for the NCLEX? Or you could go to our cheat sheets and you could look for that condition here. And so new cheat sheets are being added every week. We continue to add more and more as they're being written. And we look for COPD. I want to take a look at that. And I can come in here and see this is 2.5 pages long. And this is everything you need to know about COPD for the NCLEX. So we've done the hard work for you of scouring all the textbooks, going through all the resources, and finding out what does the NCLEX consider the most high yield information. And we've compiled that into these cheat sheets. And so we've broken it down for you on the patho, diagnostic studies, interventions, and we've come up with these NCLEX star points. And so these are the top 5 points that we feel from all our research is going to be the most likely things you're going to be asked about on the NCLEX. And so we've brought those to the front for you so that you can either go an in-depth review and read this whole thing, or you can kind of browse the star points. And then at the end, you can test your knowledge by answering our questions and kind of see if you feel like you know those kind of big high yield points. So like I said, I think these are fantastic. I wish I would have had them when I was taking the NCLEX. But you can see that we have a lot of topics in here. So we can either look at all of them, or you can split them out by like adult health, child health, fundamentals, management of care, and so on. So awesome study resource if you haven't checked those out yet. There are a couple ones that you can view for free. I think Krista's posting that link for you so you can kind of get a sense of what's on there. All right. So that is NCLEX Bootcamp. Those are all of our resources on our site, so feel free to go check it out. We do have a couple of additional resources. So we have our Facebook study group. So if you go to bootcamp.com/NCLEX, you can find us on Facebook, so you can get some community support with everyone else who is studying to take their NCLEX as well. We do weekly webinars here on YouTube, and so if you've missed the ones previous to this, you can find them. They're still archived on our page. We have Instagram and TikTok. I actually just finished filming some Instagram and TikTok shorts today. Those are super helpful. They're kind of like the top 3 things you need to know about specific topics for the NCLEX. If you haven't checked them out yet, make sure you go over there and follow us on TikTok or Instagram. I really like these shorts. They're a lot of fun. And like I said, they're pretty high yield topics. So if you're kind of studying or you're just kind of scrolling through, those are a really helpful resource as well. All right. Here is where you can find us. I think Krista is dropping those links as well, and she might also have a discount code, I see. So if you're still here with us, make sure that you grab that discount code if you were thinking of wanting to use NCLEX Bootcamp for studying. And like I said, make sure that you check us out YouTube, Facebook, Instagram, TikTok. We love to hear from students. It kind of makes our week, so feel free to leave us a comment and say hi. So for anybody who is taking their NCLEX soon, I wish you all of the best of luck, but I'm sure because you're using Bootcamp, you won't need luck because you'll be ready for it. And if you have any other questions, make sure that you drop them in the chat for Krista. And if you just want to say hi to Krista too, I'm sure she'd love to hear from you. So, all right, that is all I've got from you. I hope you guys are having a good week, and I will see you next time, okay? Take care. Bye.